Good afternoon, everyone, and welcome to the Board of Health meeting of November 1st. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's June 16, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, and Section 20, until April 1, 2022, this meeting of the Chatham Board of Health is being conducted in person and via remote for public participation. Every effort will be made to ensure that the public can adequately access the proceedings of this as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410, conference ID 584-176-986#, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. Now I'll turn the meeting over to Chairman Beckley.
Thank you, Judy. Before we begin our regular agenda tonight, I would like to propose that the board go into executive session to discuss strategy relative to the enforcement action at 32 Mill Hill Road. And because this discussion may have detrimental impact on the position of the public body. So can I, by roll call, have a vote to go into executive session? Noble Hanson?
Aye.
Ron Broman?
Yes.
Ed Sheehan?
Yes.
Carol Boyce?
Yes.
And I vote yes as well. So we have the votes to go into executive session.
John, you just want to indicate the board will come back to open session once you complete the executive session?
Yes, at the completion of the executive session, the board will come back into open session to go through the regular agenda items. So we will return. Okay, this is the portion of the meeting tonight that's public. We have, on the Board of Health agenda for tonight, 4 agenda items. Let's start with item 1, which is a show cause hearing regarding sewer connection order for Patrick O'Brien at 4 Youngs Road. We all got correspondence from Judy regarding the history of this property and a copy of the request from the owner that the order be withdrawn. And I don't know, Judy, if you wanted to summarize kind of what we're looking at here.
Patrick O'Brien is the owner of the property, and I believe he is on the call. His property is at the corner of Youngs Road and Barn Hill Road, but sits below the road, and he would like to wait until the sewer comes down Youngs Road to connect. But perhaps Patrick can speak for himself.
Hi, can you hear me now?
Yes.
Yes.
So, I mean, that's a pretty good summary. The house fronts on 4 Youngs Road. It's on the corner of Youngs Road and Barn Hill. And the elevation difference between, on my lot, on Youngs Road, it's the frontage is over 205 feet. And there's a difference of over 10 feet of elevation left to right across the front of the lot. So the simplest way of putting it, where the sewer comes out of the house, the sewer invert, and I'm using the engineering term, is versus where the sewer lateral was stubbed for the property on Barn Hill Road is too low. So it will not allow for the gravity flow of sewage from my house to the street.
Now, this notice was this is John Beckley. This notice was originally sent in 2014, if I'm not mistaken. So how do we get from 2014 to 2021?
So, yeah, so Mr. O'Brien had, I believe, verbally spoken to the DPW director at the time, Jeff Colby, and he thought that he had an agreement that he could connect, but looking through our records, it was never a formal approval to connect to the Youngs Road, which hasn't been constructed yet. So when we sent out the last round of reminder letters, he contacted me and I said, well, you need to get a formal request into the Board of Health if we're going to rescind the order, which would be what we would be doing.
Let me ask another question. Is it customary here in Chatham that when a newly completed stretch of sewer goes by a house, that they're ordered to connect, even if it's not in front of their house, but it's on the side of their house, where this is a corner lot? We have a lot of corner lots, obviously, and you're going to have plenty of instances where a house sits on a corner, and a sewer line, a newly completed sewer line may go by the side of the house, may go by the front of the house. But it's customary for us to send a notice of connection even if it doesn't go by the front of the house?
No, the way it works is when we're designing the sewer system for the road, the engineers will pull the septic plans for all the properties that abut the road. So if you're in a corner, like this case, if you're on the corner of Barn Hill and Young's Farm, when they're designing it, they would pull the septic plan for the property that fronts on Barn Hill. And then determination would be made based on the location of the septic system and other factors, whether it looks like the more advantageous is going to be to connect on Barn Hill or on the side street. And we do that for all the corner properties, if you will. And then, so if we're going down the street with construction and it was deemed that it was more appropriate to put the lateral, on the main road, the lateral would be put there. Now, in some instances, property owners during that process, during the construction process, because they will get a notice put on the property that says, here's where the engineers have determined the appropriate location for your lateral is going to be. This is where it's going to be put. If you want to change it, let us know. And so, we do hear from some property owners that say, oh no, can you move it 10 feet, 50 feet? Can you move it to the side street because it's more appropriate? I don't have to disturb my landscaping or dig up my driveway or whatever the reason is going to be. So that's generally the way it's done, is the engineers design it where they feel it's most appropriate. The homeowners are given notice, given an option to move it. So we do have some that we know about already that have been on corner properties that we've either not issued an order or rescinded an order because we've heard subsequently from the property owners.
But
such as
in this case, it's, if I understand this properly, the differential for this homeowner from connecting to Barnhill versus, is whether to pump or have a gravity system.
Right. And I couldn't tell you right now because the sewer on Youngs Road hasn't been designed, whether or not this property would be able to be served by gravity or not, or whether Youngs Road will even be gravity. Youngs Road could turn out to be low-pressure sewer, in which case everybody along that road would have to have a grinder pump. Because we
Okay.
haven't done any design yet in Youngs Farm, I can't tell you one way or the other what the situation on Youngs Road may be once that sewer is finally designed and installed.
But what is clear is that if this homeowner was required to connect to Barnhill Road, he would have to have a pump system.
That's what the owner is saying. I didn't have a chance to pull the design, but depending on where their septic system is, that could be the case.
Mr. O'Brien, have you gone to the point of having an engineer review your elevations and determine whether a pump would be required for you to connect to Barnhill?
That's my understanding, yes. My father met with, there was a company that was going door to door when they were doing the sewer hookups for the neighbors on Barnhill Road. And he actually had a map with the elevations of the sewer line, that the new sewer that was in Barnhill Road. And he said, looking at the elevations of our site plan, he said that gravity's not going to work. You'd have to build a pump system. He said it's just, he said the sewer is stubbed too high.
Well, Board of Health questions, comments, reactions?
Mr. Chairman, what I might suggest is it's not necessary for you to necessarily take a vote tonight. What I would suggest is I will have our sewer engineers take a look at this property in particular. The elevation of the stub that was put in, the elevations coming out of based on the septic plan, because that's what they would normally review. And we could take a look at that and just confirm one way or the other whether or not this property could meet the existing lateral by gravity or would require a pump. And I think that would be helpful for your board to know definitively, because honestly, some of the firms that were soliciting business earlier on in the process, I wouldn't absolutely take them at their word, I guess is the politically correct way.
A little hearsay, perhaps.
In some circumstances, yeah. So I would just like to confirm that this property can or cannot connect to the existing stub by gravity or not. And then bring that back to the board, and I think that would be helpful for you to make your decision.
Board members okay with this?
Yes.
Just deferring it until a future meeting to get more information. Do we need a motion on that?
Should we continue to the next meeting?
Okay. Can we have a motion to carry this issue until the next Board of Health meeting, to November 15th? Anybody else? Can we have a motion? We have a second?
I'll second.
Ron, you made the motion then, right? We have a second. Anybody wish to comment on this before we vote? Okay, all in favor of the motion to defer this to the next meeting, pending more information, say aye. Aye. Any opposed? So, Mr. O'Brien, you're going to have to sit tight for a little bit and wait for us to kind of get a bit more information, and we will
Okay.
list this at our November 15th Board of Health meeting on the agenda. We'll come back to it,
Okay?
okay? Thank you.
Okay. All right, thank you.
You're welcome. All right. Item 2, we have a variance hearing and approval of IA Technology for Tim and Christine Cohen at 848 Fox Hill Road. Representing them is Clark Engineering. Mr. Clark, are you on?
Yes, I am. Can you hear me?
Yes, sir.
Hey, David Clark, Clark Engineering on behalf of the Cohens. What they're seeking to do is demolish an existing 5-bedroom house and reconstruct a 6-bedroom house. We provided the floor plans of the existing house. Is basically 5 existing bedrooms plus an office. And what they're constructing is a 6-bedroom house plus a bonus room that doesn't have a door. So it's just a 1-bedroom shift. We're providing IA technology, and as you know, IA technology reduces the nitrogen so that what's going into the ground after construction is less than what's currently going into the ground. We're pretty much done with permitting. I think we're finishing up with conservation this Wednesday. They basically approved the project. They just need to write the order of conditions. And I think they're going to be moving quickly to get a building permit and get construction started within the next 4 to 6 weeks. If there's any questions, I'll be happy to answer them.
How does a bunk room work into this overall calculation? I'm seeing a bunk room.
Bunk room is just another bedroom.
It's got three beds in it?
Yep. There's no differential, for our definition,
Okay, it just is a single bedroom.
just a bedroom, yep.
Okay. And you mentioned the bonus room. Where is that?
That is on the second floor. It's a room that's,
I think they've labeled it office.
oh, okay, yep.
Well, this is Noble. I have a question. I count 5 bedrooms, the master on the first, and then I see 1, 2, 3, 4 bedrooms on the second floor, so that's 5 bedrooms. Where's the 6th bedroom that I'm missing?
I think they're calling I would call the office the 6th bedroom. The loft has open railings all the way around the stairway, so it really is a loft. It's open to the stairway. The other question would be the gym area in the basement, but that's mostly below grade, although it does have a walkout to a patio. So I would say that the office is the 6th bedroom.
What's Mr. Clark's understanding?
Yes, the office has a door, so that would be considered the 6th bedroom. I was looking at the loft, I'm sorry, as the area, but Judy described it accurately in that there's a railing that it's open to below. So the office has a door, and so because of that, it has the area isolation necessary for sleeping purposes.
And in the basement, there's a wine cellar with a door.
No windows.
No windows.
No,
So that is no possibility of being a bedroom.
no.
Okay.
Mr. Chairman?
Yes, Bob?
Yeah, David, Why wouldn't the gym area in the basement also be considered a bedroom? It does have a window, it does have egress directly to the outside with the walkout?
And a bathroom.
And a bathroom?
And it,
Well, it's a pass-through room, so it doesn't have the isolation for sleeping purposes.
A pass-through to where?
Outside and the wine cellar,
No,
and
No.
and the mechanical room.
no.
This is on the opposite
he's got the,
side.
he's looking at the pool room.
You're talking about the pool room, David.
On the right, the gym area.
Oh,
Under the office.
Yeah, that room should probably be opened up somehow to make,
it all depends on what that window's probably too high to,
it does say high window.
Oh, high window.
But what about, aren't there windows onto the patio
It's a slider, isn't it?
or sliders?
Yeah.
is that what that is, a slider?
I don't know.
They didn't give us,
Yeah, this looks like it could qualify as an additional bedroom.
yep.
I will let the architect know that they have to open up that door.
Do we want to get more information, Mr. Noble, get more information and continue, or just?
Are there any other questions on this application other than the status and the classification of the gym area in the basement? Anything else? Everything else is by the book, Judy? The IA, everything looks good?
Yes, everything else looks fine, and it would be deed restricted to 6 bedrooms, so I think just clarifying the space in the basement, the gym area, would be a condition that you could put on it. You could go forward with the approval with revised plans that I could look at. It's up to
But
you.
how would that gym space be retrofitted in a way that would disqualify it from being considered as a bedroom? I mean, taking the door away is not going to accomplish.
Usually, I would have them open that space out, take the door off, and widen the casement. Again, it gets to that, how wide do we want it to be? The bathroom is a problem.
They'd have to make the bathroom smaller.
Could make the bathroom smaller or take the
Well, it's a
bathroom.
half bath anyways, there's no shower in there.
Well, in order to create enough width so that that space could not be occupied as a bedroom, we'd want to see,
They could take out like part of that bathroom and widen that out to a 5-foot cased open.
or a
possibly.
5-foot cased opening.
Well, I think we could do the 5-foot cased opening. There's only about 2 feet we can take out of the bathroom, because we have a door to the exterior there.
Right.
That we need to open. And again, there's no bathing fixtures in that half bath.
Okay, so we could approve it tonight with a condition that the gym area be reconfigured in a way that assures a minimum of 5-foot opening
Without a door,
without a door.
approved by Judy.
And the subsequent revised plans to be approved by Judy. Is that something the board members are okay with?
Are we okay with the pool room? Are we okay with the pool room? I mean, that's,
Yeah, I don't see any problem with the pool room.
Yeah, I mean, it's almost all completely below grade. There's no, doesn't even look like there's any windows. So anything that's below grade by a certain percentage and has no egress windows is not considered a bedroom.
Okay.
All right, can I get a motion?
This Noble, okay, I'll make a motion to approve the variance for 6 bedrooms with IA technology, providing that the gym area is reconfigured so that there's a 5-foot archway entrance without a door, to be approved by Judy.
Can I get a second? Second. We have a second. Mr. Clark, do you want to comment, or anybody else want to comment before the Board of Health votes on this?
No, I'm fine with that condition.
Okay. Okay, all in favor of the motion, say aye. Aye.
Aye?
Any opposed? Hearing none, motion carries.
Thank you.
Oh, yes, wait a minute, we have to read we have other standard conditions that Judy's,
I actually sent the conditions to David today, but I can read them
just for the
for
record.
the record.
Yes,
The applicant should restrict the property to a maximum of 6 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall sign a covenant with the board agreeing to comply at such time as the Chatham Board of Health and/or Board of Water and Sewer Commissioners directs the connection of this property to municipal sewer. And the deed should also cite that there is an IA system at the property. The covenant and 6-bedroom deed restriction shall be recorded at the Barnstable County Registry of Deeds, and a copy of the executed covenant shall be submitted to the Board of Health. Throughout the life of the system, it shall be under an operation and maintenance agreement. It shall be leased for 1 year and be with any Mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably in May and October. The effluent shall be tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standards of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years testing, application can be made by the board for its agent for review and possible modification of the monitoring requirements. The applicant agrees to a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineer's site plan will be allowed without further review by the Board of Health or its agent, and this variance would be granted pursuant to the State Environmental Code Title V of the Town of Chatham Subsurface Sewage Regs, and is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1 year, or the variance shall expire. And then the last condition would be that we change the workout space doorway to a 5-foot
pursuant to our motion.
pursuant to the motion.
Okay, everybody's okay then with this being read in afterwards, correct? Okay. All right, thank you, Mr. Clark.
Yeah, I was just looking at the plan one more time, and I think I know why the architect probably went that way. Because under Title V, if you have more than 9 rooms, you take the total number of rooms and divide by 2 and round down. So I think that's why they were thinking they were all set with the number of rooms in this house. So it was my understanding that Chatham doesn't go by the state standard in that particular definition of bedrooms.
Right. As a policy, we have not done that.
All right. Thank you, Mr. Clark.
You're welcome, thank you.
You're welcome. Okay, let's go to item number 3 on the agenda, which is an update and a discussion on Chatham water quality. Is that right? I'm sorry, I've got two different things bopping around here.
Here's the revised.
Okay, item number 3, which is an update and a discussion regarding John McGrath at 32 Mill Hill Road. Dr. Duncanson?
Okay, so just to update the board, last week, at the board's request, a letter was sent to the town manager and copied to the Board of Selectmen regarding clearing of the road right-of-way or the road layout, which was in the process of being staked. That letter went to the town manager requesting that once the road layout was properly staked, that there would be assistance provided to the Board of Health and staff from the DPW to remove material that was in that road layout. At the time that that memo was sent, we weren't aware, but I did receive notification late this afternoon from the surveyor that the road layout has now been staked. So with that information, I will meet with the town manager tomorrow. I did speak with her about the memo before it was sent. I also subsequently spoke to the DPW director. Obviously, there was some concern about, the town removing all that material from the road layout as to how it would be funded. So now that we know that the road layout has been staked, we will further that conversation and as quickly as possible move forward with getting the material removed from the road layout. So that is the up-to-date on the update on the McGrath property, and I'd be happy to answer any questions.
And then, this is Noble, I would assume that after that's done, then the next phase would be the rest of the property, and there's a whole series of things, inspection, a determination of what has to be done or not, coordination with the fire department, and that would be a separate process.
Right.
That might require a warrant article for funding in the May town meeting.
Yes, correct. As we've discussed in the past, there are next steps that can be taken with regard to the material on the actual McGrath property as opposed to within the town's public right-of-way. So, yes. Yep.
Any questions or comments for Dr. Duncanson? Thank you, Bob. All right, item 4, is it? Does anybody from the public wish to comment or?
Hi, no, that's fine. I'm just happy it's moving along. So thank you very much, and we look forward to seeing a nice clean roadway.
Okay, thank you. Item 4, update discussion regarding Chatham water quality.
Okay,
Dr.
so
Duncanson.
the latest information, as I'm sure everybody's heard, even if you weren't at town meeting on Sunday, the 24th, the 2 articles related to the PFAS contamination in the town's public water supply wells passed unanimously. The first article had to do with the construction or finishing the construction for wells 10 and 11, which are the ones that are located in the northwest corner of town. Those wells were started back in the 90s. The casings and all and the screens for those wells were put in place. But the well buildings, the pumps, they were never finished because at the time, MTBE, which as you may recall used to be a gasoline additive, was detected, and so the wells were basically put on hiatus. Unlike PFAS, MTBE will naturally degrade over time. In addition, groundwater, as you know, moves at a foot per day, and so in intervening years, any MTBE residual has moved beyond the capture zone for those 2 new wells. So that article was to fund the completion of those 2 wells and bring those wells online. That was in the works even before the PFAS was detected, but obviously now with the PFAS being detected in wells 5 and 8, completion of those 2 wells took on some added urgency. So the funding has now been secured to go ahead and finish those 2 wells. And then the second article, which was $1.4 million, was to design a treatment facility for wells 5 and 8. Again, that was something that was already in the works, primarily from the standpoint of iron and manganese, because both of those wells were approaching the level where iron and manganese needed to be dealt with. Obviously now with the PFAS detection, that in and of itself has also taken on added urgency. So those wells will now be designed for iron and manganese, well, not the wells. A treatment facility will be designed for iron and manganese removal as well as PFAS removal. So it will be similar in design to the facility that was constructed a couple of years ago for wells 6, 7, and 9. This will serve wells 5 and 8 to remove iron and manganese, as well as PFAS. The second component of that article was to procure the granular activated carbon vessels, which are designed specifically for PFAS removal. Right now, they have a 5 to 6 month lead time from the time an order is placed. So the funding was secured to get that order placed, which was done shortly after town meeting concluded, with the hope of getting those vessels in place on a temporary basis by April of 2022, so before next summer season. And then basically move forward with the design of the wastewater treatment plant, with the idea that once the design is complete and funding is secured for that facility, basically the treatment building would be built around those vessels containing the GAC for PFAS removal. And then add the vessels for the iron and manganese removal, so that once that facility is complete, it will provide both iron, manganese, as well as PFAS removal for wells 5 and 8. So that funding was also secured, so that is all going to move forward now, hopefully on a timely basis, so we can have wells 5 and 8 treated for PFAS before next summer season. And then the treatment facility itself be completed probably with another year to 18 months after that. Probably a total of 3 years to get the facility up and running. So that was also successfully passed at town meeting, so.
Good.
And then we're still working on the PFAS source assessment study. We did receive a number of proposals for that. Unfortunately, they really are apples and oranges. So we're looking now to come up with a standardized scope of services, submit that back out to the various folks that submitted, and hope to get a much narrower scope. And so we're comparing apples and apples, because the price ranges varied from about 10 to 15,000 up to 75,000.
Oh, boy.
Because the scope of services from the various providers, because we didn't send out a scope. These were proposals that came into the town. So now we have to kind of tighten up the scope a little bit, send it back out to these companies, and hopefully get something back that we can compare easily, instead of what is right now a fairly broad scope. So that is also in the works.
Thank you.
Okay?
Questions for Dr. Duncanson? Okay. Let's move the agenda to item 5, which is an update and a discussion regarding COVID-19.
Okay, so let me share my screen, and I will give you the latest update on COVID-19. I know the last couple times I've done it, you folks haven't seen the actual graphics. Usually they come along Tuesday for the Board of Selectmen meeting, but I did have a request to kind of put it together in time for this meeting. So what we have here up on the screen right now is our monthly COVID-19 of confirmed cases. Right now we have a total of 406 confirmed cases in Chatham since the beginning of the pandemic. So going really back to March of 2020, if you will. We started in January, but we didn't have any cases in January and February. We saw our first cases in March of 2020. So 406 cases total. We had 10 cases in October of 2021. We had 8 cases in October of 2020. So just about the same number of confirmed cases. Right now, we have 2 active cases in Chatham because the rest all occurred earlier in the month of October and have basically gone past the 10-day period from the time they were, the case was first detected or they had a positive COVID-19 test. And then we use 10 days after that to say whether or not the case is still active. So we have 2 cases still active right now from the cases that we had in October. Of the 10 cases in October, 5 were in vaccinated individuals, 2 were not vaccinated, and 3 were unknown, meaning they didn't provide that data to the contact tracer, or they haven't returned phone calls or messages to get in touch with the contact tracer. So there's 3 cases where we don't know their vaccination status.
So how many cases did we have in August and September, Bob? Like
We
what's-
had,
I'm looking at I want to see like the last 3 months.
yep. In August, we had, I have a sheet where I have them totaled up by each month, so if you just give me a second here. In August, we had 24 confirmed cases. And in September, we had 35. And that's why in the graph, you could see that that spike in August and September after we'd had a fairly low May,
Yeah.
June, and July for 2021. And then we saw that spike in August and September, which, you know, is by all accounts related to the COVID-19 variant. But things are trending back in the right direction to the point that we only had 10 cases in October. And that's mirror what's been happening in the Commonwealth as well as across the country. We had that
Okay.
kind of COVID-19 spike in late summer, early September, and now we're seeing cases drop off, you know, fairly dramatically compared to what we saw in that little mini spike.
I know we probably have discussed this in the past, but I sometimes forget things. Why are half of our cases in vaccinated people? That seems like a high percentage to me.
It's related primarily to the COVID-19 variant. They're so-called breakthrough cases. You know, 50% seems a little high, but, you know, obviously we have 3 individuals, we don't know their status. And they could be vaccinated individuals, which would make it 8 out of 10, if you will. So that would, you know, wouldn't be 50%, it would be much lower. But we all know that the Delta variant is very highly contagious, and a lot of cases are such so-called breakthrough cases where vaccinated people are testing positive, even though they may not have any symptoms or they have very mild symptoms.
So this is an aspect or feature of the variant in the sense that more breakthrough
It's a
infections
feature
are
of the
seen to be
variant and
occurring.
also vaccines. I mean, vaccines, as you know, the doctors on the board know, are not 100% effective. You know, we haven't gotten 100% vaccine effective in anything yet, although there are some, you know, there are some that are very close. But in this case, it really is a case of the variant, the Delta variant being highly contagious, and so even people that are vaccinated. And, you know, that's one of the reasons why just recently, even vaccinated people in certain scenarios are being urged to get a booster shot. And there has also been recently discussion about a 4th shot for immunocompromised people. and it's just a reflection of the variant is highly contagious and the vaccines are not 100%. So,
All right.
and then just quickly, a couple of other graphics here. Percent positivity, which is a reflection of the number of positive tests in a community. Again, you see that spike that we had in the August-September timeframe. It dropped off fairly precipitously, and then in last week's number, because remember, these data are always a couple of days old because they're only issued on a weekly basis, and they're actually data for the previous 2 weeks. We see a little bit of a spike.
Okay.
Going back up again last week compared to the previous week. On the 21st of October, our percent positivity was 1.02%, and on the 28th, it had risen to 1.25%.
Okay.
Not a huge number, but again, it's just a reflection that I'd love to see it continuing to go down, but it didn't. For the same period, on the 28th, the Barnstable County rate, so the county as a whole, was 2.98%, and the statewide 14-day positivity average was 1.76. So, Chatham was below the statewide average, and about a third of what it was for Barnstable County as a whole. So that was good news. And on the 28th, at 1.25%, Chatham was the second lowest on the Cape. And I will tell you that on the 21st of October, when Chatham was at 1.02%, we were the lowest town on the Cape. So both of those were good news. Because we're kind of getting back to where we were in late June, July, when Chatham had some of the lower rates, and then we saw a spike up as all the towns did. And then just mirroring the percent positivity is our average daily incident rate. And that's based on number of positive cases per 100,000 population in the previous 14 days. And you see the same similar spikes, and you see that same similar uptick between the 21st and the 28th. So that just, hopefully that doesn't continue up again and we get into another spike, but only time will tell. And then just quickly, a couple of other things. Statewide, confirmed cases by age. I've shown this many times before. I haven't shown it recently. But again, it just reiterates that the 20 to 39-year-old age demographics are continuing to have the highest number of positive cases. They're not as high as they were earlier. Earlier, they were up around 20% in both of those categories. But because we are starting to see an increase in case in the younger demographics, so those less than 19 years old. So that's taken away a little bit of on a percentage basis at least, the higher case counts that we see in the 20 to 39-year-old demographic. And again, this was data reported as of last Thursday for the previous 2 weeks. And then the final thing I just wanted to show was, again, something we haven't shown in a while, the vaccination percentages. And this is comparing data as of last week with data as of July 20th. So back in the middle of summer. And you can see, other than the fact that there has been a number of now age demographics that are all at, quote, 100%. And this is based on per capita members in the community, so not absolute numbers per se. We continue to make progress on the vaccination front. More people are getting vaccinated. especially in some of the younger age groups that became eligible for the vaccine later than others. But as you notice, there's nothing shown for folks under the age of 12 because none of those age groups have yet been approved for vaccine. Although the FDA has approved the Pfizer vaccine for those 5 to 12, FDA has approved it. The CDC is meeting on it this week. So potentially by the end of the week, children 5 to 12 will be eligible to receive the Pfizer vaccine. And the agencies are currently reviewing that for Moderna and also the J&J vaccine. So hopefully there'll be more good news coming out in the next couple of
Bob,
days.
I don't know if you have heard any information. I've heard some on national media that the strategy to get these younger kids vaccinated may be different than what had been the national model for the adults, in the sense that they were not going to be recommending mass clinics, but rather an integrated approach through the pediatric practices across the country to just kind of chip away during well visits, et cetera, and begin opening it up, but not in a...
Yeah, right now, there are no plans to do mass vaccination sites like Massachusetts did earlier last spring and all. The intent is to roll out pediatric vaccine to healthcare providers, health centers, pharmacies, and other places, just because there's so many places now where you can get vaccine. And so the thought is, as well as the schools, a number of schools will be holding clinics. They're not being required to, but a number of schools have already indicated they will hold clinics.
Okay.
So the thought is there's enough places now where vaccine is available that they don't need to go back to the mass vaccination site
Okay.
kind of scenario.
Yes, no.
Yeah, Bob, do you have a weekly case rate for October, just to see a trend? I mean, is week by week, or?
I can provide that. I don't graph it that way.
Okay. Well, let me just ask then, have there been any clusters, in October, or any
None that we're
businesses that
aware
have had to
of.
close?
Nope, none that we're aware of. We haven't had any closures of any restaurants or anything recently, so.
And I'll bring it back to what I had said before. I think the numbers have come down to what they were before we put the mask order in place. And we're always going to be worried that there may be another surge or another variant. I mean, that's going to be here for a long time. So I'm thinking, well, when we put it in an order, I think it's important to think when we take it back. And I'm thinking that we should rescind the mask order for town buildings when you're indoors. And I've stated before that there's one board that would like to have that. The community center can be used more actively. But I would ask Bob, is there something we don't know about that we should consider in terms of the town, or feedback you're getting, or whatever?
I'm not aware of anything from a public health perspective. As we said, we're not aware of any spikes. I would say probably the one or two things that came into play in recommending the mask order to the board the first time around, or one, and then one other item to consider is we are going into the fall winter season. We're in there now. People are going to be spending a lot more time indoors. And we know that, that leads to more spread. So that's one thing to consider. And then the other thing to consider, one of the reasons why we recommended the indoor mask order for meetings when we did, was we had gotten a fair amount of feedback from town employees that attend these various meetings, that, there was a certain uncomfort level, if you will, because of, a large number of the public. Now, fortunately, the board's not seeing that at your meetings, but at some of the other meetings, like selectmen and HBDC and planning board and some of the others that were pretty well attended. There was some concern on the part of staffers that were present at those meetings about people wearing masks. given the fact that there's really no way to know of any particular individual's vaccination status or not. So I just throw
Well, I
that
mean, I
out
would
there.
suggest that we consider rescinding the order, and we would go back to the guidelines, so each chairman of a board meeting or committee meeting, if he sees a packed room, he can ask that mask be worn or not. That would sort of follow the guideline. And I don't know what other people think, but I've just, like I said, I've had people say they'd like to use the community center and be able to use the gym and exercise and play pickleball and use the exercise room and, you know, and use their own common sense and follow the guideline. And the select board has asked us to give them discretion, which basically means go back to the guideline. So that's kind of what I'm thinking, that the fear that we'll have a spike in the winter, that's going to be here. And then when the winter comes, you get in there a few months, and then it's going to be people coming back in the summer. And so I think it's going to be, to me, it's based on the numbers we're experiencing at the time. And we could put this mask mandate back on at any time. I mean, you know, based on the numbers. To me, that's what it seems like. So I'll put that out there.
I personally would like to see one more month of down cases, because, you know, we're not that far from the end of September where we had a good number of cases. We've had one good month in 10 cases, and I'd like personally to see November's data before we would make that move. However, if there's other opinions on the board that want to be expressed, we certainly can consider everybody in terms of how you want to manage this.
Yeah, I see it like our board right here. I mean, we really don't need to wear masks here. I mean, we're all, I'm sure, been vaccinated. We really never have anyone here. And I think going with what Noble said, is it should be up to the chairman or the leader of that group, make that decision. Like, if the selectmen feel that they don't need it, let them just make that decision.
How would the public that's planning to attend an upcoming meeting know whether the chair of that meeting is going to require a mask or not, and whether they should bring one or not? I guess is one of the thoughts that I
Well, the
have.
selectmen, I don't know what they have for people coming to the meetings.
I thought the Board of Selectmen requested a waiver from them having to wear a mask if they're all sitting 6 feet away. I don't think they were asking
And there were
for,
very few people in the audience, I think they had said that too. But
And the
But-
people at
they would have the discretion to do it.
but were they asking for a waiver of the mask mandate in the audience? I don't think they were.
No. They were asking, I think, for people speaking at the podium and the select board
Themselves.
themselves.
They wanted the authority to waive the mask requirement for themselves if they felt they were at least 6 feet apart and they didn't feel the need. And we had concerns about having kind of a perception of a double standard.
Well, you go to the grocery store, and once in a while, you'll see people our age wearing them. And most of the people, younger people, are not wearing them. And it doesn't seem to be pushing the numbers way up because of all the people that are not wearing masks.
Well,
You have to
first of
assume
all,
they're-
grocery stores have a ton of air,
Yeah.
right? I mean, there's a lot of airspace, and I
There's
don't
a lot of
think,
people in them, too.
well, but I don't, you know, I've got a son-in-law, I mean, a nephew that works as a bagger, and there were no, you could count the cases traced back to Stop and Shop on one hand. I mean, there just weren't a lot of cases. I think because of the dilution of the air and the fact that it was policy that all the employees wear masks. I don't know, what do other people think? I'd like Dick to have a chance to at least offer his comment. That would be another reason to carry it, is for a future meeting agenda.
Sure. I mean, this will be on the agenda for, you know, every meeting, COVID update, and we can discuss it. Can wait, you know, until next week or after Thanksgiving, the end of the month, you know, to discuss it again. We could discuss it our next meeting's on the 15th, so,
That'd be another 2 weeks.
yeah.
Carol, do you want to weigh in here, or you want to hold off?
I'd like to stick with it,
Leave it in place
yeah,
for now?
yeah.
Okay.
Another, try it for another month.
Ed,
Oh,
so repeat what you said?
yeah. Yeah, try it for another month and
See where we
see
go.
where we are.
Okay.
It's either going to be a level or it's going to be a drop.
Right.
Oh, boy.
Carol?
I think we should wait another month, especially where there was a little uptick,
Yeah.
and see how it goes, or at least a few weeks, maybe till our next meeting.
Okay.
And if the number continues
All
to
right,
go
I'm not
down-
reading right now broad support to do something tonight. What I am hearing is that board members are willing to, or wish to proceed a bit more, see some of the next month's data, but have the option to act in an upcoming meeting if we get to a comfort level in doing that, in which case it'll, won't be that far into the future if things break the right way. So it's an ongoing agenda issue, Noble, that I think we're going to watch it, and you can make your case on an ongoing basis as we approach the next couple of meetings.
Yeah, I'm okay with that, and we have a discussion each meeting about the COVID with the update, and so we can bring it up each time and see how we're going. But I just
Okay.
think we look ahead to when we hopefully can rescind the order.
Okay. It's a
When
good perspective.
you say rescind the order, are you talking about like at meetings like this with us swearing them? Or are you talking about the community center?
Everybody. Right now, our mandate requires mask wearing in all town meetings,
Town buildings.
town buildings,
Meetings, for meetings and.
for meeting rooms.
And in the community center for activities.
Okay.
So at other what's an activity for people going into the gymnasium?
Yes.
So if you go into one of those other rooms, you don't have to wear them?
If it's a meeting in a town meeting facility, or the gym or the exercise room at the community center, you have to wear a mask.
It's any place in there, okay.
Yeah.
So
if
a
you're-
yoga class,
if
a
you're-
yoga class,
Huh?
a yoga class
The yoga class would
be required.
be required to wear one, yeah.
Okay.
And then the state guideline, which if we rescinded the order, we'd go back to the state guideline. I believe that is, if you're vaccinated or unvaccinated indoors, you should wear a mask.
If you're,
It's a
if you are
it's a recommendation,
Guideline.
guidelines, yes.
Guideline.
So, but
So
if
we
you-
rescinded the order, that guideline would be in place still.
Right.
But
It's,
it says, so what does it say about a vaccinated person going indoors?
vaccinated or unvaccinated indoors, you should wear a mask guideline.
Recommended.
Yeah,
Right.
Okay.
recommended. But that, so if we rescinded our order, which is on top of that, it would go back to that.
Then each
Guideline.
person would make their own decision.
Right.
So you're going to have a blend of people, some in masks, some without masks. Okay. I think we've covered this. Thank you, Bob,
Your
for
discussion.
your report. We have minutes we have to approve for October 18th. Everybody should have gotten a copy of them in your packet. Can I get a motion to approve the minutes of October 18th? Unless somebody has an edit or a correction. Okay, we have a motion to approve. Do we have a second?
I just had one question. It says in the second page, 1, 2, 3 up, Robert Duncanson, anything in the road layout can be removed by the town staff using DPW funds. Are we actually there yet? Yeah, under consideration.
I guess it's under consideration. I mean, that's what that was the concern the DPW director brought up was, he doesn't have a pot of money sitting over here not being used for anything that we can tap into. So obviously, if we expend DPW funds, either from manpower or equipment or disposal fees or whatever, that has to come out of some finite existing budget. And what that means at the end of the fiscal year, I don't know, because I don't know what kind of numbers we're talking about.
All right, so it says
You know, so
can
it-
be,
it's-
so it
it's
can
in
be, we're just
discussion.
working out the funding yet, okay?
Yeah.
Yeah.
I mean, if it's relatively easy and we can go in and pull everything out in an hour and be done with it, okay, it's a small number. If it's a multi-day thing and we have to pay disposal fees, then the number goes up. And we don't know what that number is.
All right, we have a motion to accept the minutes for October 18th. Can I get a second for that?
Second,
Oh, you made the motion.
make the motion.
Noble, second.
Noble's going to second it. Okay. All in favor of accepting the minutes of October 18th, say aye.
Aye.
All right, we're at the end of the meeting. If anybody doesn't have anything else to add, can I get a motion to adjourn? Unless everybody wants
Motion
to
to
stay
adjourn?
here.
Noble?
Okay,
I'll second.
we have a second. All right. Everybody in support of the motion to adjourn, say aye.
Aye.
Anybody opposed? No. Adjournment passes. Thank you, everyone. But we like to play close to the edge, don't we?